May I please request you all to have a seat, please? Ladies and gentlemen, I am Dr. Ashvi Solanki from Department of General. I would like to welcome you all here to this auditorium on behalf of the Department of General Surgery here at Lokmanya Tilak Municipal Medical College and General Hospital for the inauguration of the S.V.NADKARNI Seminar Hall. It gives me a great honor to welcome you all in this auditorium, as I have recently learned that this auditorium was not present when many of the dignitaries were working here. Dr. Prabhakar, the head of Department of General Surgery, would like to personally welcome you all and hope that you all have a good time here. I would now like to welcome Dr. Anil Brado, sir, to carry forward with the further proceedings of this event.
Good morning, ladies and gentlemen. On behalf of the Department of General Surgery, specifically Dr. Prabhakar Subramaniam, head of the department, I formally welcome you all to this gathering. It's indeed, it's one of the most enlightened days in this century, I would say, because seeing all of you together, not only at your peak, but super peak, here, facing each other and meeting each other, and the joys on your face, which I have experienced over the last 15 to 20 minutes, is something I want all of us to enjoy over the next 2 hours. 2 hours of a very crisp but a very, very important function for the program. And I would like all of you to cooperate as well as coordinate well so that we can really have a good time. So to start the morning session, it is my privilege to invite Dr. Prabhakar Subramaniam, Head of Department General Surgery, to please come up on the stage here and take the seat. Dr. Prabhakar Subramaniam is a gentleman, as all of you know him. Those who don't know him, by the end of this program, will know he's a perfect gentleman. And I was privileged to study my general surgery during my general surgery exams with Prabhakar, and we used to just read a topic to each other. So because we couldn't just sit through a book, I couldn't. So I thought it's best to catch Prabhakar, sit with him and that, chalo, ek topic tum bolo, ek topic main bolunga, ek topic tum bolo. So that is how the entire preparation for those 3 months, when we had the leave for preparation for the exam, I think it was 2 months, we did. And luckily for me, I could also pass as proudly as Prabhakar Subramanian could, and I could also move ahead in my career. So Prabhakar, welcome to this August gathering. It's my privilege to invite a speaker par excellence, a teacher who has made a difference to the life of not only the residents or the colleagues or peers whom he has taught personally his art and science of his medicine, but he also made a difference to the lives of so many others, not as patients, but as colleagues who have worked in other departments. And mind you, it was not because of his excellence in his subject, but also because he was very humane, and he was one of the most handsomest consultant teachers in the LTMGH hospital then, and I bet when he comes up on the stage, you will see that he is one of the most handsome consultant teachers even today. My pleasure to invite Dr. V.K. Mundra on the stage here. All of us remember that for the medical college meetings and programs, if we had to find someone who could make everybody laugh, everybody also look back at themselves about the seriousness in life and about reflecting on how we should deal with our day-to-day challenges, we always as undergraduate students and postgraduate students found no one else except Dr. Vasant Mundra to address gatherings. So without wasting too much time, I will request Dr. Vasant Mundra, who's been the head of Department of Psychiatry at the Sion Hospital, and for those who do not know that history, he's been a leading consultant psychiatrist at the Shushrusha Hospital and the Hinduja Hospital, and in his field, in psychiatry as well as in allied fields, wherever he has been asked to speak, he's always made the difference. So please give him a big round of applause, and let's hear from sir.
Good morning. This is the kind of bakwas introduction that makes. Now I have to worry about how I am looking. Ye umar mein. And I could have understood if his wife said so. What is he saying? Okay. All right, I am Vasant Mundra, psychiatry. I joined Sion Hospital in 1980. So people around that time might remember me a little, and then I left at around 2004, 2005, around then. So I was here almost 25 years. And then subsequently been at Hinduja, Shushrusha, others. And so it's a great pleasure to be able to come every year, 2 years, 3 years, to see the way this place is growing. Dr. Nadkarni may not remember, but I was over here when you were dean. And I was one among the many. So I was basically from KEM 1967 batch. And because of WhatsApp, now you know, people know each other. And when people know each other, then there's a question of getting together and all, which we didn't have 7, 8 years back also. So since 5 years, we have a usual chat group, GSMC 1967. And we decided to have a reunion. And the reunion was being organized, so there was a bunch from Pune. 3 people got together. They said that they will organize and everybody else from all over India and abroad will come. And they started organizing this event. Everything was paid up, everything was done well. They showed us all the pictures of the place, etc. 3 weeks before the event, before the reunion, out of the 3 organizers, 2 died. And this meant that we went to the reunion, we didn't cancel it, and we all sat there on the first evening when everybody gathered together before they started with their glasses. We stood up for a minute or 2, and we otherwise enjoyed the reunion. This is about growing up. This is about becoming old. That to be very, very clear in one's mind. Now, many of you are older than me. I have entered, she said to make it not so old, perhaps so old, young soul, this, that, and all that. Because for me, getting old is freedom. Chutti. It gives this whole business of age and kya jarurat aur kya sochna aur kya cheez ka chinta. Suddenly, it's all over. Suddenly, the whole way of looking at life is different. Very clearly, yeah, people whom you have been with and you're chatting with and suddenly they disappear. And so shall you. So till then what? We are all in our bonus years. And bonus years mein kya karne ka hai pehle se. It is such a big thing for me when I see my patients. 30 साल पहले मैं घर में शादी करके आई थी. मालूम है मेरी सासू ने क्या कहा? तेरे बाप को अक्कल नहीं, बेटी को ऐसा भेजते. मी माझं हिस्ट्री सगळं लिहित जातो. I go on writing every word. I go on looking down and writing, so I don't have to look at their face all the time and show expressions. अरे वाह बेचारा बेचारा and all. पूरा लिखने के बाद एंड में बोलता हूँ मेमोरी टेस्टिंग करते जरा, स्कूल में टैगोर का कोई पोयम था, नेहरू का कोई लेसन, गांधी का कोई स्पीच, ठेंगा याद है? न टैगोर का याद, न नेहरू का याद, न गांधी का याद। 30 साल पहले सासू क्या बोली वो याद है। मतलब क्या पदवी दिया है, अबव गांधी। बहुत होशियार, बहुत समझदार आपकी सासू, गंवार अनपढ़, फिर भी उसकी बात याद है। अब कैसी है सासू? नहीं तो मर गई। मर किधर गई? खोपड़ी में बैठी है, खोली दे के रखा है, भाड़ा नहीं कुछ नहीं, परमानेंट टेनेंट, पेट्रोल खा रही है। फॉर अस टू बी लिबरेटेड, it is such a glorious time to be old, to be able to look forward and learn how to forget. Thank God the brain helps us. It helps us to forget many things. We definitely forget names, we forget people's faces, we forget when we were, where we were. But we also have the freedom to forget so much. The human brain is a tragic organ. It is the most recent in evolution. ये किडनी लिवर हार्ट कब से चालू है? थ्रू वेरियस एनिमल्स गेटिंग पॉलिश्ड इन एवोल्यूशन. अपना खोपड़ी इज द मोस्ट रीसेंट एंड इन दैट सेंस इज देयरफॉर द मोस्ट imperfect organ, the organ which does the least efficient work. This human brain has great capacity to imagine the future, very little capacity to predict the future. Now to live with this whole ability to imagine and live with this ability with very little ability to predict. It has great capacity to learn. We teach all our children, grandchildren how to learn. Absolutely no method of forgetting. Now, if somebody were to make computers that way, that you cannot delete, it would never work. But apna khopdi. Now, whatever little we have in terms of memory, kitna GB hai, we have no choice to be able to say, off. सब पेशेंट्स को बोलता हूं जरा फोन संभालो, मेमोरी डाउन, बैटरी डाउन, हैप्पी न्यू ईयर, हैप्पी दिवाली, हैप्पी न्यू ईयर, हैप्पी दिवाली डिलीट करने का. एंड दिस हो आमी करतो नहीं ऐसे खोपड़ी से मैं करते हो क्या? हाउ मच हैव वी रजिस्टर्ड कि ये चीज अभी निकालो, ये चीज छोड़ो. इट इज सच अ वंडरफुल फीलिंग दैट थिंग्स डोंट मैटर, थिंग्स आर रियली नॉट इंपॉर्टेंट. हु मैटर्स? मैं सोचता हूं तो nobody's opinion matters, nothing matters. Having spent a lifetime as a TV और सबके हाथ में रिमोट, वो बटन दबा तेरे में लाल, उसने बटन दबाया मैं पीला, उसने बटन दबाया हरा. द फ्रीडम की कौन सा भी बटन दबाओ फर्क नहीं पड़ता. इन एवरी सिचुएशन, किधर लाइन में खड़ा हो गया, किधर रोड पे चलाते, वी शुड सी पीपल. इट इज सो फ्रीइंग टू बी ओल्ड एंड नॉट टू वरी अबाउट ट्रैफिक. और नहीं तो बचपन में गाड़ी चलाते चलाते कोई लेफ्ट से ओवरटेक किया, अगले सिग्नल तक एंड एडवाइस, दिखता नहीं लेफ्ट से चलाता है, कौन लाइसेंस देता है, किधर से घुस जाते हैं. कौन लगता है अपना जवाई होने वाला है क्या? गिविंग हिम एडवाइस, फ्री एडवाइस टू मेक हिम अ बेटर ड्राइवर. इवन टुडे आई डोंट गिव फ्री एडवाइस अनलेस आई गेट फीस. फीस दो तो फोकट का एडवाइस काय को. 5 सेकंड का कांटेक्ट है, चला गया, पर अगला 15 मिनट तक जबड़ा टाइट, चेहरा लाल, हाथ स्टीयरिंग टाइट एंड डिस्कसिंग ओनली हिम. अपने देश में होता है, परदेश में होते हैं, अंदर हो जाते हैं, साला पुलिस कुछ नहीं करता है हफ्ता का. घर वाले बोलेंगे जाने दो ना, जाने दो के कारण अपना देश ऐसा है. क्या हुआ? somebody overtook. We are so vulnerable. Growing up means I cease to be one. I tell everybody, drive on the left. सबको ओवरटेक करने दो. करना क्या है? गरीब आदमी है, ड्यूटी पर हाजिर होना पड़ता है, अपन सेट है, पहुंचेंगे तब पहुंचेंगे, पेशेंट बैठेगा. The whole idea of being able to promote oneself, to promote vulnerable. इसने ये क्या किया, उसने ये क्या किया. And the kids train me all the time. I love going for my morning walk to Shivaji Park Maidan. I start from one point and come back to the same point. Start at the one point and come back to the same point. Somebody who's looking from Mars might wonder, ये क्या कर रहा है? किधर जाता नहीं है, खाली वापस ही आता है. Doing what? I'm burning calories. And after having burnt calories, I go out and tell people, don't burn calories, don't waste fuel. India में ऐसा हो जाएगा, वैसा हो जाएगा. साला मैं ही तो बढ़ता हूँ, जाल गोल घूम के I'm burning calories. Why? Because it's medically right. I must burn calories. So I love walking. Everywhere I walk, except in the rains. Morning walk नहीं बंद कर दिया. Because कपड़ा गीला हो जाता है, doesn't matter. Shoes गीला हो जाता है, वो बड़ा problem. सूखता नहीं. So my children know that. So I told my children कि भाई rains में तो I don't go for my morning walk. So my daughter is on the phone from England. Dad, you buy 3 extra pairs of shoes. I said, what? Yeah, one will dry, after another, then another. हफ्ते में 3-4 shoes में हो जाएगा तुम्हारा. You can. I said, what are you talking? You know how much it will cost? She said, Dad, it sounds like my mother used to say, Vasant, the kids have decided to treat me like that, and then it made sense. क्या करेगा वो पैसे का? Suddenly there is freedom. I can go walking in the rainy season. The whole realization, the whole perception कि अपना खोपड़ी चेंज करके, our value system चेंज करके अब किसके लिए बचाना है, किसके लिए रखना है, it is so much freedom. It is so much. My wife is always, she keeps buying clothes, goes on piling up clothes, and नवीन हे आणलंय, हे तर कधी घालणार आहे, कधी घालणार, तुला काय करायचंय, मी आणलंय. I told her once, ये तेरा अंतिम संस्कार होएगा ना, मैं लकड़ी नहीं खरीदने वाला हूँ, तेरा सब ड्रेसेस रखूंगा, उसके ऊपर तेरे को रखूंगा. She started, oh, बरोबर है, and started laughing. And she tells her friends, माझा नवरा म्हणतो अंतिम संस्कार में कपड़े. The friends don't know whether to laugh or to feel sad. अंतिम संस्कार है, अरे हमारा रोज का धंधा है, अंतिम संस्कार होता रहता है, मिलते रहते हैं, देखते रहते हैं. The loss of this whole thing hanging on the head. क्या हो सकता है, क्या हो जाएगा, कल क्या होगा, बच्चों का क्या. Old age is freedom. Old age is the real bonus. It is the ability then to enjoy, to free ourselves. And I wish all of you welcome to old age. Thank you.
Sir, 1 minute, just one. So as sir has rightly said, welcome to old age. We would like Dr. Prabhakar Subramaniam, our head of Department of Surgery, to felicitate Dr. V.K. Mundra. How a lecture should be short as well as sweet is so well demonstrated here. And I think all of us have to not only learn from sir's experience and the easy way of explaining things, but also follow so many things which we would love to emulate. Thank you so much, sir, for starting our proceedings on this very auspicious day. And I wish you a very good health and a very good life ahead, sir.
Good morning, everybody. I'm Dr. Rushi Kalani, and I'm a surgical resident here. I would now like to request all of you to please follow us and Prabhakar sir to the actual inauguration of S.V.NADKARNI Surgical Seminar Hall on the first floor of this building. And it's going to be a short 10 minutes affair, and it's also going to be telecasted live here on this screen. So any one of you who would just want to sit here and look at the live telecast is welcome to do so. Please. Thank you.
This hall was designed. There were two teachers, but this hall was very much close to Dr. Nadkarni's heart. He was the only person who used to be insistent on 3 o'clock postgraduate clinics, and we used to sit here and learn whatever philosophy, concepts, wiring, discussions, dissections of the cases, everything we learned here as postgraduates. Sometimes after coming from OT, we used to be, feeling sleepy. Sometimes we used to be hypoglycemic, but still, you had to come here at 3 o'clock and nobody would go away before 3 o'clock. That was the discipline of Dr. Nadkarni, sir. This hall was very close to him as far as the postgraduate training was concerned. And his two philosophies I remember. He never entertained anything for postgraduates in the morning hours. That was his philosophy. Because he said that nobody comes early, nobody goes late except him. And the first 4 hours are for undergraduate students and the patients who do not have any voice. That means that if you neglect them, they may not complain against you. So this was the scenario, and this hall was very close. So the engineers, Mr. Sai Mote is here, Mrs. Renuka Telang is here, this hall is, and Uzalambe is here from Civil. Please come. These people have crafted this hall based on the architectural model of seminar hall in Mayo Clinic, Rochester. So this is one of the beautiful hall. It has got interactive board, and like we are having live YouTube session from this hall, we could telecast anything and every proceedings in the nook and corner of the world. And this is how the hall is really crafted, and these are the engineers. We must thank them. We will formally felicitate them in the seminar room. But this is the beauty of this hall. And I did not interfere, I did not give them any suggestion, I did not cut any corners on their budget. And they have done it in the most beautiful way. So this is about hall. We can go up as per the directive of Sangeeta. Okay. Prabhakar, you will have to accept. Anil, Brado kude? Brado?
Excuse me.
Yes. This hall is, it will not work on the ordinary brooms. So I told Sangeeta that we have done so much for this hall and named after him. So you please donate one vacuum cleaner, and she has done it so. Thank you so much. We will all go on.
Please requesting all of us to go to the main auditorium. We will just proceed immediately. Thank you. Thank you so much.
surgeon. To realize that vision is what really separates the men from the boys. Trauma ward at Sion Hospital is a classic example. Those were the days when there were no CT scan or MRI, not even in memory surgery, right? Ultrasound. Yet we were trained to evaluate a trauma patient based almost purely on clinical examination. In fact, even the ward staff were clued in and would recognize the need for maybe a cut down or an ICD or even a tracheostomy and have the sets ready even without us having to ask for them.
Having said that, like all great personalities, he did have one or two quirks. I guess the elephant in the room is the saga of the Wangenstein suction. Prof was convinced that respiratory complications that inevitably developed within a few days of an unconscious trauma patient were due to aspiration of oropharyngeal secretions. To prevent this, he was a staunch advocate of continuous low pressure pharyngeal suction. Now in those days there was no mechanized gadgets to help us in this respect. So we had to resort to a bulky, fiddly, double bell jar, a modified siphon that connected to an infantry tube that we placed in the pharynx. One of his greatness was a stickler for details. And on his rounds, he would check the system right down to actually personally using a laryngoscope to check the position of the catheter tip. Basically, it had to be absolutely bang in the middle of the pharynx. Now, what was unfortunate, and you can confirm this with any of the trauma registrars of that era, was that this blessed contrast
surgical seminar room
and of all the others, to help us in this respect. Trauma registrars of that era, that close and respect.
मैं करता हूँ. Hello. Thank you, ladies and gentlemen, for your patience with the program set for going forward. May I request all of you to please take your seats. Dr. Ravi Gupta, Dr. Pankaj Patel, please organize everybody on their respective seats. I'd like all of you to give a big round of applause to Dr. Mohan Joshi, the Dean of LTMG Hospital, who has joined us this morning. He's here in the front row. He says cheers to all of you. Namaskar. And Dr. S.V.NADKARNI, sir, professor, spent the most valuable years of his life in the Department of Surgery. What Dr. S.V.NADKARNI sir was from his childhood till he became a college student, undertook medical education, and then took on the responsibility as a surgeon and subsequently as head of department. I'm sure all of you would like to hear from none other who knows much more than all of us combined together. And it's my privilege to invite Dr. Sangeeta Pikle, daughter of Dean Sir Professor Nadkarni, to come up and give us this brief history in her own views to the august audience. Dr. Sangeeta Pikle, here you go.
Good morning, namaskar, and at the outset, I'd like to thank Mohan Joshi sir for this wonderful gesture of his through the Sion Hospital, and all of you for having come here today morning. So when I was planning what I should speak about Baba, there is just so much I can say and so much I should not say. But I'm going to say only those things which everybody possibly has heard, but have not always, maybe some of you don't know about it. I'll begin with a story. Baba was, so SVN was born in 1932, a home birth in a Girgauchi Tsar. And though he was not the eldest, soon grew up to be treated as the eldest of the family. He's one amongst the 6 brothers and 1 sister, and born to Umabai and S.V.NADKARNI. My grandfather was a very simple clerk, and financials were not great. He was called Sada by everybody, and his friends called him Nadia. His early beginnings were tough. The grocer's book, the Kirana Vahi, pulled the family along for meals. And frugal living, that's where he learned, and maintaining the costs has been his stay from those early learnings. He was schooled in Marathi Municipal School till the 4th standard, and he moved to Pune with his family thereafter. Pune is where he got his full education. He thinks he's a Punekar. From his early age of 10 years, for a period of over 12 years, he worked for Rashtriya Seva Dal, not RSS, RSD, making roads, digging wells, marching for freedom struggles, reading and listening to great socialist leaders like Ram Manohar Lohia, S.M. Joshi, G.P. Pradhan, and the Gandhian teachings by Acharya Bhagwat and Anna Sahib Sahasrabuddhe. He still carries their ideals. He was selected to sing the first Independence Day Rashtrageet from atop the Shaniwar Vada solo. After completing his MBBS, MS General Surgery from BJ Medical and Sassoon Hospital, he moved to Bangalore as a reader at Wenlock Hospital, which was more like a Jilla medical center. He served the poorest of poor with limited resources. 5 years of this experience, he then joined Goa Medical College as associate professor, the only surgeon at Raibandar Hospital, Goa. Patients from Goa, Savantwadi, Karwar, Kankon would come to him, and SVN was a plastic surgeon, oncosurgeon, peds surgeon, general surgeon, all rolled in one. Dr. NADKARNI, that's the way the Goans called him, Dr. NADKARNI, a Konkani-speaking doctor, was looked upon as a god figure. The hospital would send an ambulance with a written call in those days, and SVN would immediately go to the hospital. His dedication to his patients was unparalleled. He has personally treated Satya Sai Baba when he developed appendicitis in Goa. In 1972, there was a death in the family, a niece who got appendicitis and died. SVN said, I need to be there for my family. He moved to Bombay. He got selected in the interview to join as head of Department of Surgery at Sion Hospital, LTM Medical College in 1973. He moved into the British-built barracks in T66. He was entitled to the Varali quarters, actually a little bigger and a nicer quarter, but he wanted to be close to his patients. So we lived amongst clerical staff, class 4 employees, and SVN there in the Chal was called Nadkarni Kaka. He never had discrimination of caste, religion, so the house was open to all. Chhaya Geet, Phool Khile Hai Gulshan Gulshan on the black and white Bharat TV meant that we had more than 50 to 60 people gathering in the barracks in his living room. When he joined, there was no department of surgery. He was given a table and a chair in the old MRD section, and some cupboards were moved to shape it like a cubicle. In fact, if some of you students see, there's a wall there and steps leading. There used to be a Tilakansa Putra where Tilak has now moved into this building. He doesn't have a mustache the way he had it that time. He had a mustache like a Charlie Chaplin. So the earliest title he got was Charlie Chaplin. Later on, people realized he was very strict and authoritarian and had that mustache looking like Hitler. So he also had a title called Hitler. But the longest of time, people remember him as SVN and Prof. But he did get another name when he started doing his night rounds, suddenly appearing somewhere, and his never die attitude. So he got a name called James Bond. And by a strange coincidence, the room number of the dean's office is 007. He was one of the first deans who occupied that room. SVN was the dean, so obviously we got nicknames, Beti Dean and Beta Dean. Mrs. Nadkarni, my mother, her name is Suhasini, and everybody will agree that she is always Suhasini. She's sweet and smiling. She made a mark to many of you as the smiling host, always ready to feed the students. Sion was his karma bhumi, And to his credit goes the creation of India's first trauma center. You read any reference on Sion Hospital, in articles, papers, Wikipedia, the one department that shines is trauma. And he started in 1973. He also started the ambulance with the OT and the postings of trauma registrar around the same time. And ambulance service 102 was the number given. And SVN, whenever I speak about this and say, Baba, you did it, and he says, we have to thank Dr. Panse, sir, for having always supported every endeavor. We remember Panse, sir, for his support. He later started Golden Hour Project in 1982, which was inaugurated by the Prime Minister Rajiv Gandhi. He was the first to start the OGD Scopy in Surgery department, a department which is doing brilliant even today. The SVN coma scale, which every surgical resident used, was an easy coma scale devised by him for assessing head injuries. It's a proud privilege for me as an aunt to say that my niece S.V.NADKARNI has done a research for ICMR, and she has compared Glasgow coma scale in a prospective study with SVN coma scale and proven that it is a superior tool. Flapless tracheostomy, for all the doctors who were working with him, they know, I think flap tracheostomy or flapless tracheostomy, and Wangenstein's slow pharyngeal suction, which, he was very famous for that, were his techniques for extreme trauma head injuries, and Sion had the best results. He created a transport system by which patients were transported. He got an MOU signed with the Western Railway, and patients were put into the trains and brought to Matunga railway station, and the patients were picked from there. So they created an innovative method to move patients. The major calamities they managed was one train colliding with the other, which was a huge casualty at Matunga, a massive fire in Bharat Petroleum, electrocution of an entire train bogie, chlorine gas leaks. These were huge casualties that were managed brilliantly in Sion trauma and emergency services. The busiest hospital with Antop Hill, Dharavi, Kolivada, and poor people gave SVN tremendous valuable experience as he served. And he then converted the UHC, the Urban Health Center, to also become the IPD Center. That center was then inaugurated by Vasant Dada Patil, the then CM. One of the innovative things he did was the integrated care of critically ill. At that time, cardiology, surgery, intensive care, everything was different. So he decided to move all critical care into a single building in the front. And he said critical care is a specialty which at that time was not recognized. Understand, this was way early in 80s. And therefore, he made anesthetists as critical care people and posted anesthetists in surgery wards. And when he did this critical care, he had taken paid leave and he was working in Sion for 16 hours, which was our complaint to my father. Teaching UG, PG, like Mohan Joshi sir said about teaching, he was very passionate. They would also have evening classes. And during his surgery tenure, he started departments of plastic, gastroenterology, respiratory. He also started special pediatric surgery ward and burns ward. SVN could tie sutures, I don't know, the residents know, with a single finger. He would just move one finger and make knots. Why? Because suture vatsvaitsa, cost effective. So everywhere he would look at cost effective methods. He learned computers at the age of 70, 75. When he attended the class, he told us, "Sagre teacherचं वय total केलं तरी माझं एवढं पोचत नव्हतं." Whenever healthcare and education are looked upon as profit making, he gets upset. Recently, Kumar Ketkar met us, and when I told him about this event, he told me, ह्या वयात सगळे म्हातारे मागची आठवण काढतात, तुझे बाबा मात्र अजून उद्याचं बघतात. A very positive person, always looking for tomorrow because he wants something good for the next generation to come. He worked for energy conservation, from Jatropa oil to solar system. He even bought a Reva car for us, which we drove for 5 years. And saving and reducing carbon footprints has been a big zeal for him. He worked diligently for the Paraplegic Foundation till his age of 89, 90, when actually he was still told, please continue, because he was very close to it. Bhatia Hospital, then Jaslok, he was a director, was also invited to be advisor to Goa government when Minister Parikar was there and Amankar was the health minister. He started the Goa Trauma Services. Karma Yogi, one incident, Karmarkar sir was my head of unit when I was doing surgery, second MBBS. I got jaundice. Ramurthy sir said, "Ghari bas, stay at homes, you're sick." And Karmarkar sir met me at the posting, and when I went to take signature with my sick leave, he said, "Tuja babani sangitlay tula repeat de." So I said, "Why repeat, sir? I had jaundice." He said, "Your father has told me repeat." I went back to Baba, and Baba said, "Yeah, you got jaundice, but you didn't learn surgery." So I got a repeat. So in Diwali vacation, I was the only student with his residents doing a repeat, and all the residents were very happy. Karma Yogi, he never chased awards nor lobbied for them. Many times I used to say, Baba, nobody ever gave you an award. And he said, but I didn't do it for awards. I did it for the patients and for the students. He really never, even today when I told him this event 2 days ago, when I told him, he's saying, Arey, why are they doing all this? I did what I was supposed to do. मी काय चांगलं केलं बस, पण okay. I'm very happy that I got such lovely parents. I'm very fortunate. And that is why I can't ask God for more. On behalf of Dr. S.V.NADKARNI, Vibha Nadkarni, my vaini, Shivram, wherever you are, yeah. Riva, my husband Hemant Pikle, Vibha's I think outside. Vibha's here. I thank you all for joining us on this working Saturday. Thank you very much.
No. Thank you so much, Sangeeta. I think all of us must have really regaled in the history, some which all of us knew wholly, some partly because of a personal interaction with Sir, and of course a lot so much more because Sangeeta worked so hard and has been coordinating so well to make sure that everyone here in this audience, all those who are sitting here as well as those who are looking at this live transmission, are getting all the information that she's gathered. Please give a big round of applause to Sangeeta. I think it's not just an honor, it's a pleasure listening to every small bit about Professor and Sir, what his life has been about. It's really, really remarkable. Now it's my pleasant duty to request our respected Dean, Dr. Mohan Joshi, Sir, who is the son of the soil, as one would say, because he's been born and brought up, as far as in the medical language is concerned, in this very building. His first MBBS was in this very floor. His second MBBS was one floor down. Contrary to, you rise as you go from first, second, third to third MBBS. But in our hospital, or at least in our building, you go down, Third MBBS is on the third floor, second MBBS on the second floor, first MBBS, final MBBS is on the first floor. So here we are with Dr. Mohan Joshi, Sir. Dr. Mohan Joshi, I remember, because my first house post I did, a lot of time people ask, are you to Dean ko jante hain? He was my registrar. They don't know I was his houseman. So, yes, pleasant memories of Dr. Mohan Joshi, Sir, being a registrar when I started my residency. And of course, Dr. Nadkarni, Sir, was at the helm of affairs. He was the professor, head of department, and subsequently Dean. So we have gained so much. But I think what Dr. Mohan Joshi has learned over the number of years, not only through his experience with each individual he's come in contact with as a professional or as a patient in Sion Hospital, I think all of us may not have had that opportunity. Also, Dr. Mohan Joshi, Sir, had the great fortune of being involved with Professor Dr. Nadkarni, Sir, over a long period of time. And we'd be very, very happy to hear from him his comments, his observations, and his take-home message, as well as his experience with Dr. Nadkarni, Sir. Dr. Mohan Joshi, Sir, the stage is all yours. Hello.
माझे परमपूज्य शिक्षक डॉक्टर S.V. नाडकर्णी, ज्यांच्याबरोबर मला एक हाऊस पोस्ट आणि काही काळ रजिस्ट्रारशिप करण्याचा टाइम किंवा वेळ मिळाला माझ्या आयुष्यातला, परंतु त्यांना आम्ही खूप जवळून बघत राहिलो आणि ॲज अ मेडिकल स्टुडंट, पोस्ट ग्रॅज्युएट स्टुडंट त्यांना परसीव्ह करत राहिलो. ते डॉक्टर नाडकर्णी, सौ नाडकर्णी आणि इथे बसलेले असंख्य माझे शिक्षक, माझे रजिस्ट्रार डॉक्टर S.P. नाडकर्णी आहेत, डॉक्टर अनंतराम आहेत, डॉक्टर चौकर आहेत, गोल्डन आवर प्रोजेक्टचे डॉक्टर गौतम सेन आहेत, किती लोकांची नावं घेऊ, डॉक्टर K.K. मेहता आहेत, माझे मित्र डॉक्टर सातोस्कर आहेत जे प्रोफेसर आहेत ह्याला सोमय्या कॉलेजला, डॉक्टर गीता नियोगी एक्स डीन ऑफ सोमय्या मेडिकल कॉलेज, आणि माझे दोन अतिशय उत्कृष्ट हाऊसमन, वन वॉज कम्पेअरिंग डॉक्टर अनिल ब्रॅडू अँड सेकंड इज कम ऑल द वे फ्रॉम सांगली डॉक्टर राजा गुंडावार. हे सर्व आहेत. काही आठवणींना फक्त उजाळा देतो डॉक्टर नाडकर्णींसंबंधीच्या, आणि त्यावरून डॉक्टर नाडकर्णी कसे होते हे तुम्हाला कळेल. डॉक्टर नाडकर्णी अतिशय ह्या हॉस्पिटलमध्ये दोन शिक्षक होते असे की हू टच्ड touched our hearts, and one was in first MBBS, Dr. N.A. दाभोळकर. ते फिजिओलॉजीचे प्रोफेसर होते. त्यांच्या संबंधी इथे बोलण्याचं कारण नाही, परंतु इथे बसलेले सर्व लोक जे आहेत बहुतांशी ते सायन हॉस्पिटलमध्येच MBBS झालेले आहेत बहुतांशी. त्यामुळे डॉक्टर N.A. दाभोळकर was one of the distinguished teacher of physiology and in first MBBS. He was like a yogi. We never saw him coming. We never saw him going. That means that he came so early. He went so late. We never saw him on any day on leave. He was always there. असे डॉक्टर दाभोळकर होते. And at 9:1, not even 1 second, 9, he would enter in physiology lecture hall, and then we had to sit according to the roll numbers. He would finish. There was no biometric required. He would finish his attendance in exactly 30 seconds to 40 seconds. He would note down on a small piece of paper किंवा BSTच्या तिकिटावर ॲब्सेंट आणि रिकामे बेंच असलेल्या लोकांचे नंबर, आणि देन ही वुड स्टार्ट हिज लेक्चर अँड एंड एक्झॅक्टली ॲट 10 o'clock. अँड इन बिटवीन ही वुड क्वेश्चन and he would call somebody and ask question by name, and then that time only that person would raise his head or her head and start answering. He was such a great person, Dr. Dabholkar, that every day at 4 o'clock we used to have tutorial for half an hour on the subjects which were taught in the last lecture time. And at 4:30 it would end. We never had any off for the lecture during Dabholkar's time, because anybody who was absent, he would take over the subject. So that was a distinguished teacher, and when he expired, we thought that an auditorium or a lecture hall, which was called as Physiology Lecture Theatre, where he started the lecture sharp at 9 o'clock, and he was so much passionate about his teaching. He was ex-dean also for some time. So when we had a condolence meeting, we had the condolence meeting in the very same hall and named the auditorium, which was called as N.A. Dabholkar Auditorium. And the same thing I thought that I should do it for Dr. Nadkarni, because सरांच्या मी प्रत्येक ठिकाणी पोचलो. I became the professor of surgery in the very same institute, though there was a threat of transfer to Nair, but somehow it could be avoided. I became professor and head and sat in the chair of Dean, Dr. Nadkarni. And later on, fortunately or unfortunately, whatever you can say, I also took over as Dean and became a regular Dean in same chair where Dr. Nadkarni sat. And the hall which was very close to Dr. Nadkarni's heart, सरांच्या हृदयाशी, तो म्हणजे सर्जिकल सेमिनार हॉल होता. या सर्जिकल सेमिनार हॉलला एकच हॉल असा होता की ज्या हॉलला अकॉस्टिक particular, what do you say, that the आवाज will not be transferred out. अशा तऱ्हेचा तो हॉल होता. It had a wooden partition or wooden sort of wall which was there to the, so that you could not, have any nuisance of outside noise. आणि मी 3rd MBBSला हॉस्टेलमध्ये राहायचो आणि तिथे खूप गणपतीची गर्दी असायची. गणपतीचे ते 14 दिवस खूप लाऊडस्पीकर, घोषणा, गाणी, इतर प्रोग्राम यांनी आम्ही हैराण व्हायचो. तर मी 3rd MBBSला जनरल सेक्रेटरी होतो आणि त्याच वेळी माझी परीक्षा होती. आणि त्यावेळी मी सरांना विचारलं की या हॉलमध्ये आम्हाला तुम्ही बियॉन्ड वर्किंग आवर्स अभ्यास करायला देणार का? कारण लायब्ररीत बसून सुद्धा उपयोग नव्हता. लायब्ररीत बसलं तरी बाहेरून खूप आवाज यायचा. तर सरांनी त्याला म्हणले, तू जबाबदारी घेशील का किल्लीची? तर म्हणलं घेईन, नक्की घेईन. आणि सरांनी मला तो हॉल वापरायला दिला, त्याची आठवण मला होती. आणि दररोज आम्ही 3 वाजता सर्वजण, सर्व रेसिडेंट डॉक्टर्स अँड ऑल फॅकल्टी मेंबर्स तिथे जमायचो. ऑनररी टीचर्ससुद्धा 3 वाजता लेक्चर्सना येत असत. आणि सरांची एक अशी फिलॉसॉफी होती की फर्स्ट 4 hours आर फॉर UG स्टुडंट्स अँड फॉर पेशंट्स. आणि त्यांना व्हॉइस नसतो असं त्यावेळी ते म्हणायचे, पण आता खूप व्हॉइस आहे, काळ बदलला आहे. तर त्या 4 तासामध्ये युअर डिवोशन शुड बी फॉर पेशंट्स, युअर डिवोशन शुड बी फॉर UG स्टुडंट्स अँड देअर क्लिनिक्स. आणि म्हणून ते 3 वाजताच्या अगोदर कधीही आपली पोस्ट ग्रॅज्युएट क्लिनिक घेऊन द्यायचे नाही. आणि दॅट वॉज दी हार्ट विच वॉज टू हिज हार्ट. So we thought that we should design that hall in such a way, in an exceptional way. And the engineers took the design of a Mayo Clinic seminar room. And exactly, sir खूप simplicity नि राहणार आहेत, पण मला तो हॉल अतिशय exemplary बनवायचा होता. आणि I told my engineers that do it best, and they have done it with their intellect and all that. The contractor is also here. And we will felicitate them at the end of my talk. आणि आठवणी तर अशा रीतीने तो खूप छान हॉल आम्ही बनवला. आणि त्याचं नॉमेनक्लेचर सेरेमनी सुद्धा अशा रीतीने ठेवला की ज्या दिवशी आम्ही आमची मॉर्टॅलिटी मीटिंग किंवा OT वॉशिंग ठेवतो, सो दॅट दी होल ऑफ द डिपार्टमेंट कुड कम टुगेदर अँड अंडरस्टँड हू वॉज डॉक्टर S.V. नाडकर्णी. काही आठवणी सांगायच्या झाल्या. डॉक्टर दाभोळकर जसे ही वॉज स्टुडंट सेंट्रिक, तसे डॉक्टर नाडकर्णी वॉज एक्स्ट्रीमली पेशंट सेंट्रिक ॲज वेल एज स्टुडंट सेंट्रिक. ही ऑलवेज बिलीव्ड इन एक्स्ट्रीमली गुड पेशंट केअर अँड ही ऑलवेज बिलीव्ड इन व्हेरी मायक्रोस्कोपिक सुपरविजन. दॅट इज वॉट आय वुड लाईक टू टेल यू. डॉक्टर शैलेश्वर इथे आहेत, मी हाऊसमन होतो, शैलेश्वर रजिस्ट्रार होते, डॉक्टर गिरीश लाड इथे आहेत. आणि आम्हाला प्रत्येक पेशंटचा फोन म्हणजे रजिस्ट्रारला कॉट वाईज, नंबर वाईज, त्यांनी काय खाल्लं, काय प्यायलं, त्याला किती IV फ्लुइड्स गेली, किती युरिन आउटपुट गेलं, किती युरिन आउटपुट आलं, किती IV फ्लुइडचा रेट होता, त्याला ब्रेथलेसनेस आहे का, पल्स BP कशी आहे, याचं सर्व प्रॉपर ओव्हर द्यायला लागायची. आणि त्यावेळी when Dr. Lad and Dr. Shaileshwar is phoning up, this was during my tenure when I was a house officer, we had to sit and immediately, sir म्हणायचे हाऊसमन कुठे आहे? If he had any doubt about the registrar statement, he would say, where is houseman? And the houseman had to sit near right and left side of the 2 registrars, and 4 people only man the unit which was heaviest. So it was a Monday OPD, and he used to do any kind of surgery, take it urology, take it plastic surgery, take it gynecology, take it anything, vesicovaginal fistula closure, take it head neck surgery, take it esophageal cancer, he would do. And he was very pioneer in starting what is called as a comprehensive care for cancer patients. आणि त्याच्यामध्ये सर वॉज दी ओनली पर्सन who not only diagnosed cancers, not only operated cancers, but he also offered chemotherapy. And it was his dream that there should be a radiation oncology unit in the very same hospital. And I am telling you, sir, and promising you that if I continue to work for more 2 years, at least the building for the radiation oncology unit will come and your dream will be fulfilled. We have planned a radiation oncology unit, underground 2 and 12-storied building at the site of kitchen. It will be a standalone building. The kitchen will be shifted somewhere else, and the basement or the basement 1 and basement 2 will have a radiation oncology, and that is brachytherapy and other types of radiation therapy, ultra-modern radiation oncology setup. It will have cancer theaters, it will have cancer ICU, it will have a chemotherapy unit, etc., etc. If I succeed, which I think so, that your dream will come true, because sir had tried his level best to get AERB approval, which I remember as a resident doctor. सर पेशंट सेंट्रिक कसे होते याचा एक किस्सा तुम्हाला सांगतो. सर, not only that I have sat on the professor and head chair, then thereafter dean's chair, मी सरांच्या क्वार्टरमध्ये सुद्धा मूव झालेलो आहे आता, because our old barracks are demolished. So sir used to stay in a very next building, आणि फुल टाईम युनिटचे टीचर्स बऱ्याच वेळा सरांना कॉलवरती ठेवून जायचे की प्रोफेसर इज ऑन कॉल टुडे, एनिथिंग हॅपन्स, एनी कॉम्प्लिकेशन, क्लॉट रिटेन्शन, ब्लीडिंग, he will come and help you out. And I will tell you a story which Shaileshwar knows, which Dr. Lad knows, that I was doing my second house post in Dr. Deulkar's unit, and that time we had operated. There was not so much about the monoclonal antibodies and other things in the treatment of idiopathic thrombocytopenic purpura. And Dr. Deulkar had decided one patient who was referred to from railway hospital was referred to Dr. Deulkar, and we decided to do jointly a splenectomy for it. And Dr. Deulkar had to go to Goa on the same day evening. And the patient was in ward number 23. The patient was kept in the side room, and the patient started bleeding. There used to be no casual decisions during that time, remember, the way they happen sometimes in some units, sometimes today, that we had to inform the professor that whether this patient needs any re-exploration. And the tube drain started draining, tip, 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 blood yayala lagla, which started at about 8 o'clock. And Dr. Nadkarni, Dr. Deulkar नव्हते, पूर्वी पेजर्स, मोबाईल फोन्स नव्हते, त्यामुळे आणि असं असायचं की ते डॉक्टर नाडकर्णींच्या घरी एक एक्सटेन्शन होतं सरांच्या, आणि आम्ही वॉर्डमधून ठकठक करून ऑपरेटरला सांगायचो नाडकर्णी साहेबांच्या घरी बोलायचं आहे. आणि आय वॉज अ हाऊसमन, आय वॉज myself and Dr. Shaileshwar, we were monitoring the patient. Shaileshwar was coming in between, and the bleeding would not stop. Then we gave a lot of platelets. There was no fresh frozen plasma that time available. We sent the person to Tata Hospital to get some platelets. Still the bleeding continued. Then we phoned up. तर मॅडम नाडकर्णींनी फोन घेतला. सर आलेले नाहीत, सर बाहेर गेलेत. 10 वाजता पुन्हा गेलो. 10 वाजता पुन्हा फोन केला. मॅडमनी तेच सांगितलं, सर आलेले नाही आहेत, सर बाहेर गेलेले आहेत जेवायला. 11 वाजता पुन्हा फोन केला. ब्लड चालू ठेवलं, पेशंटचं मॉनिटरिंग चालू ठेवलं. 12 वाजता शेवटी फोन केला तरी सर पोचलेले नव्हते घरी. आणि बरोबर 12:30-1ला सर घरी आले. काही कारणाने नातेवाईकाकडे गेले होते. घरी आल्यावरती मॅडमनी त्यांना सांगितलं की मोहन जोशीचे 4-5 फोन येऊन गेले. आता त्यांना काही कळलं नाही. सरांनी ऑपरेटरला विचारलं मोहन जोशीचे फोन कुठून येत होते, आणि सर बरोबर 1:15 वाजता वॉर्ड नंबर 23मध्ये मी पेशंटला ब्लड देत होतो तिथे हजर झाले. म्हणे काय झालं, तर म्हटलं असं असं या ड्रेनमधून ब्लिडिंग होत आहे, 300-400 cc ब्लड आलं आहे, पेशंटला हायपोटेन्शन होत आहे. तर अशा रीतीने मग सरांनी पेशंटला बघितलं आणि सेड वी विल हॅव टू री-एक्सप्लोर दिस पेशंट, मे बी सम शॉर्ट गॅस्ट्रिक इज ब्लिडिंग. आणि ॲट 1:30 वी टूक अप दिस पेशंट. This was his devotion to the patients. Even at middle of the night, a patient who's operated by somebody else, some other unit, he would come and work only wholeheartedly. Number 2, that he was very much fond of this Wangenstein suction. He was very much fond of tracheostomies, which are called as flap tracheostomies, which Raja Gundavar knows, and he used to practice when he was a lecturer, even in Cooper Hospital, I remember. So he was fond of that, and he was fond of treatment of head injuries and some patients who were deeply unconscious by giving appropriate nutrition, by giving them pyracetam injections and various other therapies. Some people walked. And I will tell you a story of a patient, Mr. Hiralal, जो 3 महिने आमच्याकडे वॉर्डमध्ये व्हिजिटेटिव्ह स्टेटमध्ये होता. But he walked home. And on one day, when I was trying to buy some computer cartridges at Bora Bazar Street, त्यांनी मला बोलवलं, डॉक्टर जोशी. मी बघितलं तर हिरालाल was walking and doing some business in Bora Bazar Street. So there were innumerable patients whom otherwise we would think that they have gone. They would recover, especially the young patients. That was his strong belief. That was his strong belief. And he always worked till last positively for those patients. आणि असाच एक पेशंट आमच्याकडे होता. त्याचं नाव होतं बापू दुगड. He met with an accident. While he was crossing a railway track, he was a lecturer in Mithibai College. And Bapu Dugad आमच्याकडे हेड इंजुरी असताना 7 वर्ष राहिला. त्याचा 7वा वाढदिवस सुद्धा आमच्या याच्यामध्ये साजरा झाला. आणि बाय दॅट टाइम प्रोफेसर नाडकर्णी हॅड बिकम डीन. आणि नंतर डीन झाल्यानंतर त्यांना आम्ही इन्फॉर्म करायचो, आणि ते फक्त एकाच पेशंटविषयी इन्फॉर्म करायचो. That was Bapu Dugad. Round inform करताना Dr. Shaileshwar knows and Dr. Lard knows that आम्ही सांगायचो सर्व पेशंट हे अगदी त्यांच्या स्टाईलमध्ये सांगायचो की युरिन आउटपुट इतके IV फ्लुइड्स गेले आहेत, जास्त गेलेले नाही आहेत, कमी गेलेले नाही आहेत, ही इज नॉट डिहायड्रेटेड, so much antibioticचे डोसेस गेलेले आहेत, ॲबडोमेन सॉफ्ट आहे, पेशंट इज पासिंग फ्लेटस, एक्सेट्रा एक्सेट्रा. सो मेनी थिंग्स वी यूज टू टेल हिम. आणि मग एखाद वेळी बापू दुगडचं सांगणं राहून जायचं तर सर लगेच विचारायचे, डॉक्टर लाड बरोबर आहे ना, बापू दुगडचं काय? नाही, बापू दुगड इज ऑल राईट. डॉक्टर लाड म्हणायचे, व्हॉट डू यू मीन ऑल राईट? टेल मी हाऊ मेनी फीड्स ही हॅज रिसिव्ड. Tell me how is he, whether we had to do his weight, and all patients of head injury, their nutrition is maintained or not. We had to take the trolley to the burns ward, do the weight of the patient, see that they are not diminishing in the weight, their BUN is normal, their total proteins are normal. This is the way that we managed head injury patients. And Bapu Dugad was one of them, and we celebrated his 7th birthday in the hospital in ward number 23. He was in one corner and his mother used to look after. So कधी कधी ते आईला बोलवायचे क्रॉस कॉल करण्यासाठी, किंवा तिला विचारायचे काल बरोबर फीड गेली आहेत ना, म्हणजे इतके सर त्या पेशंटविषयी हे होते. ही वॉज व्हेरी मच अटॅच टू इट. बट ज्यावेळी आम्हाला असं वाटायचं की आता सर खूप आमच्यावरती भडकतील, ओरडतील, विचारतील प्रश्न, आणि त्यावेळी एक निराळीच गोष्ट घडायची, आणि ती म्हणजे सर कधीच काही बोलायचे नाहीत त्याविषयी. आणि असंच झालं की सर डीन असताना एकेवेळी बापू दुगड एक्सपायर झाले. मी रजिस्ट्रार होतो, लोकम रजिस्ट्रार. डॉक्टर चाफेकर, who is professor of surgery in Nair, was one of the housemen. The second houseman is here, head of the department of plastic surgery, Dr. Bhatt. आम्ही तिघं जमलो, आणि कोणालाही हिम्मत होईना त्यांना नुसतं फोनवरती सांगायची की बापू दुगड हॅज डाईड. अँड वी सेड दॅट सर जरा घरी येऊन बोलायचं आहे. अहो बोला ना, फोनवरती बोला. काही बोलता येईना, फोन पुन्हा ठेवून द्यायचो. पुन्हा 10 मिनिटांनी फोन केला, सर जरा घरी येऊन बोलायचं आहे आम्हा तिघांना, चाफेकरला, मला आणि डॉक्टर भट्टना. अरे बोला ना, तुम्हाला काय झालं, फोनवरती बोलायला काय झालं. पुन्हा फोन ठेवून दिला. तिसऱ्यांदी 5-10 मिनिटांनी पुन्हा फोन उचलला, सर आम्हाला तिघांना तुमच्या घरी येऊन 2 मिनिटं बोलायचं आहे. सकाळच्या वेळी जाणं अपेक्षित नसतं कधी रजिस्ट्रारनी, त्यांची गडबड असते कॉलेजला येण्याची वगैरे, प्रातविधी उरकून. मग सर चिडून म्हणले या, आणि आम्ही तिघं हळूहळू गेलो आणि मॅडमने दरवाजा उघडला. सर बसलेले होते हॉलमध्ये. तिघंजण आम्ही निशब्द उभे राहिलो. बोलताच येईना, काही तोंडातून काही शब्द निघेना. अरे म्हणले काय झालंय, तुम्ही बोला ना आता. मग लाडनी हळूच पुडी सोडली, डॉक्टर सर बापू गेला. आम्हाला वाटलं की आता खूप फायरिंग होईल आम्हाला, की बापू दुगड कसे एक्सपायर झाले. पण सर एकच शब्द म्हणाले, बरं झालं मी आता रिटायर होतोय, त्याच्याकडे माझ्यासारखं कोणी बघितलं असतं. हे ज्यावेळी सर बोलले त्यावेळी मी रजिस्ट्रार होतो, आणि त्यावेळी मला असं वाटलं मनामध्ये की सरांची ट्रॅडिशन कोण चालवेल या इथे. आणि म्हणून आम्ही MS झालो. MS झाल्यावरती शेवटच्या दिवशी परीक्षेच्या कॅन्टीनमध्ये 4 लोक बसलेले होतो. संध्याकाळी 6 वाजता सर राऊंडला आले आणि म्हणले काय चकात्या पटत बसलायत तुम्ही. तर माझ्या मनात इथे लेक्चरर व्हावं, कारण मी इथे हॉस्टेल सेक्रेटरी होतो, कल्चरल सेक्रेटरी होतो, जनरल सेक्रेटरी होतो. नियमितपणे सायन्सच्या सोशल ॲक्टिव्हिटीशी अटॅच्ड होतो, आणि मला काही करून हे सोडून जावं MS झाल्यावरती असं वाटत नव्हतं. आणि सर आले आणि ओरडले, म्हणाले काय चकात्या पिटत बसलायत तुम्ही इथे. ताबडतोब रणखांबेला भेटा. रणखांबे आपले AMO होते, सिनियर AMO. माझ्याकडे CMO नाही आहेत, ताबडतोब जॉईन व्हा. तर गेलो. तर काय साहेबांनी सांगितलं रणखांबेला भेटलो. आणि काय रे म्हटलं 4 पोस्ट खाली आहेत CMOच्या, फार प्रॉब्लेम चालू आहेत तिथे, ताबडतोब जॉईन व्हा, मी ऑर्डर काढतो. आणि त्याप्रमाणे नेक्स्ट डे CMOची ऑर्डर निघाली, आणि ऑर्डर होऊन आम्ही जॉईन झालो नोव्हेंबरमध्ये 87 मध्ये. आणि मग रिझल्ट लागला. मधल्या काळात आम्ही इंटरव्ह्यू दिलेला होता. तर ते मनात होतं की माझी कोण बघेल बापू दुगडला, ही जी त्यांच्या मनात एक खंत होती. आणि ते मी बघितलेलं होतं. त्यावेळी मी ठरवलं होतं की मला लेक्चरर व्हायचं इथे. मग बिसाइड्स माय पब्लिकेशन्स, अदर थिंग्स, इंटरव्ह्यू, सर कोणाचं ऐकतात, कोणाचंही ऐकत नाहीत सर. कमिशनरचं सुद्धा ऐकणार नाहीत. आता नाही मिळालं लेक्चरशिप तर कसं काय होईल, म्हणून लेक्चरशिप पाहिजेच. म्हणून एक दिवशी सर नसताना 4-5 दिवस अगोदर इंटरव्ह्यूच्या मिसेस नाडकर्णींना मी भेटलो. कारण मिसेस नाडकर्णींशी त्यांचं कधीच भांडण नव्हतं. आणि सरांना, मिसेस नाडकर्णींना सांगितलं, मॅडम मला सरांची परंपरा टीचिंगची, सरांसारखंच इथे टीचर व्हायचं आहे आणि म्हणून मला लेक्चररची पोस्ट पाहिजेल आहे. सरांना मला मदत करायला सांगा. आणि त्याप्रमाणे सरांनी मदत केली आणि मला वेट लिस्टिंगवरती ठेवलं. 4 महिन्यांनी बरोबर एक दिवशी डॉक्टर चांगलानींचा फोन आला, हु वॉज हेड ऑफ द डिपार्टमेंट. सर वॉज डीन. आय वॉज व्हेरी क्लोज टू सर, रिमेंबर. 4 महिन्यांनी फोन आला, अरे वो नेहरा जा रहा है कल यूके, तू करमरकर साहब के यूनिट में ज्वाइन हो जा. अरे म्हणलं मैं तो सीएमओ हूँ. तो बोला दूसरा आदमी को बुलाओ क्या, नेक्स्ट वेटिंग लिस्ट को. तू मेरे को बोल कल तक ज्वाइन हो जा, कल इमर्जन्सी करने को कोई नहीं है बुधवार को. अनंतराम साहेब आहेत तिथे, माझे शिक्षक दुसरे. आणि अशा रीतीने मग काय विचार काय करणार, काही हे नाही. आणि मी जॉईन झालो लेक्चरर म्हणून आणि रणखांबेकडे गेलो. रणखांबे म्हणला तुला इथून रिलीव्ह व्हायला पाहिजे पहिले. रिलीव्ह करणं माझ्या हातात नाही. त्यावेळी मला सरांनी सांगितलं अपॉइंटमेंट द्यायची, तर ती अपॉइंटमेंट मी दिली. आता रिलीव्ह व्हायला तुझा रिबेलो मॅडमकडे. रिबेलो मॅडमकडे गेलो. एवरीथिंग आई एम रिव्हीलिंग. रिबेलो मॅडम म्हणाले तुम डीन का चमचा है, जब चाहे तब तुम लेक्चरर की पोस्ट लेता है, जब चाहे तब तुम सीएमओ बनता है. सीएमओ की पोस्ट ये परमानेंट है, लेक्चरर की पोस्ट तुम्हारी एडॉक है, मैं तुमको रिलीव नहीं करूंगी. काय करणार आता. अशा वेळी डेप्युटी डीन किंवा असिस्टंट डीन त्यावेळी होत्या, त्या डेप्युटी डीन ही पोस्ट नव्हती. त्यांच्या विरोधी डीनला किती जरी आपण जवळचे असलो, त्यांचे रजिस्ट्रार असलो, तरी असं काही जाऊन बोलायची त्यावेळी पद्धत नव्हती. हल्ली कोणीही डीनच्या ऑफिसमध्ये कधीही येतात, काही छोटी मोठी कंप्लेंट सांगत राहतं, पण तशी पद्धत नव्हती. आणि मग मी पुन्हा रणकांबेकडे गेलो. म्हणलं अरे वो मैडम रिलीव नहीं कर रही है मेरे को, बोल रही है कि परमानेंट पोस्ट है ये एंड आई कैनॉट रिलीव यू फॉर एडॉक पोस्ट एंड दी सॅलरी वॉज ऑलमोस्ट सेम. काय करायचं आता. म्हटलं माझ्याकडे सोल्युशन आहे. सोल्युशन काय आहे तर म्हणे तू ऐसा कर. रणकांबेजी म्हणाले मला की सुबह 9 to 4 यू डू लेक्चरर्स ड्यूटी. Wednesday I will give you off and from 4 o'clock you come again at CMO. Wednesday is your CMO's off because it is your emergency. And again you come at 4 o'clock, 4 to 11 you work and then you go. 4 महिने झाले. मी सकाळी 9 ते 4, 3 वाजताचं पोस्ट ग्रॅज्युएट क्लिनिक, 4 वाजता बाहेर पडायचो. त्यावेळी असं काही लवकर वगैरे पटकन जायची सवय नव्हती. आणि अशा रीतीने मी 4 ते 4.5 महिने CMO आणि लेक्चरर दोन्ही राहिलो, जस्ट बिकॉज आय वॉन्टेड टू कंटिन्यू ॲज लेक्चरर. आणि 4 महिन्यांनी माझ्या घरामध्ये एक संभ्रम निर्माण झाला की हा मुलगा आलाच नाही आहे. हां या ओके, हा आलाच नाही आहे घरी. काय झालं म्हणून वडिलांनी पत्र लिहिलं आणि ते पत्र लिहिलं डॉक्टर दाभोळकरांना. तर दाभोळकर सरांनी मला वरती बोलावलं. म्हणले की काय असं मला पत्र आलंय तुझ्या घरून. म्हणलं अशी परिस्थिती आहे सर. मग मी 4.5 महिन्यांनी सरांच्याकडे गेलो आणि त्यांना सांगितलं की कॅन यू रिलीव्ह मी फ्रॉम CMO's पोस्ट. सर म्हणाले म्हणजे यू आर लेक्चरर नो. म्हणलं नाही. इमिजिएटली त्यांनी कांबळेंना बोलवून म्हणले ना बॅकडेटेड लेटर द्या. एक दिवशी सर आले आणि सरांनी आम्हाला CMO असताना आम्ही पॅरासाईट राहत होतो काढून टाकलं आरएमओ क्वार्टर्स म्हणजे याचं लगेच सर्व बाहेर काढा. म्हणलं मी राहू कुठे, मी मुरबाडला राहतो, मी CMO म्हणून येणार कसं, यांना क्वार्टर देऊन टाका. सो दॅट काइंड ऑफ करेज ही हॅड अँड विच आय फॉलो दी सेम. आमच्याकडे कॉन्ट्रॅक्च्युअल CMOज आहेत काही, त्यांनाही मी त्यांच्या धारिष्ट्यानेच क्वार्टर देण्याचा प्रयत्न केला. अशा रीतीने ही वॉज वन ऑफ दी गुड टीचर, पेशंट सेंट्रिक डॉक्टर, good head of the department and very good administrative dean. So I have followed in his all the chairs. I am really emotional and touched down. So I said की त्यांनी जे लाख रुपयाचे उपकार आपल्यावरती केले आहेत त्याच्यातली एक पै तरी आपण परतफेड करूया. And with the help of my engineering team which is over here, I will call them Sai Mote, Mrs. Neha Sankhe, who has now taken over in place of Mrs. Jadhav, and civil team, please come up. And we crafted a very good seminar hall which is named after Dr. S.V.NADKARNI. Thank you so much. Please come. Sai Mote, Dr. Mrs. Jadhav, she has been transferred to KEM. Neha Sankhe, Ujjal Ambe, Renuka. Renuka is there or not? Please come. Please come. They need a big applause because they have executed the work, including the most illuminated board, which is very beautifully placed there. That is S.V.NADKARNI Surgical Seminar Hall. Thank you so much. I have taken little more time, but because of memories and emotions, I couldn't stop. I had to be stopped by Dr. Brado. Brado, you are doing always a good job everywhere.
So on behalf of surgery department as well as the hospital, Dr. Mohan Joshi sir would like to thank and felicitate the team which has actually been responsible for the surgical seminar hall. So please, she's here. So please give big round of applause for the team which has got the surgical seminar hall ready. May I request Dr. Prabhakar Subramaniam, head of department, to please come up, please. Prabhakar has promised not to speak, don't worry. Just wait. I would like Dr. Prabhakar to, if you can please take it, to felicitate Dr. Mohan Joshi sir for an extremely emotional speech. Dr. Mohan Joshi, as I said, is the son of the soil. He has led by example, and I hear from so many who are currently working in the hospital that any problem any department has, Dr. Mohan Joshi always makes sure that he helps them, gets everything sorted out. He's really a leader amongst men. And we must all give him a big round of applause to get Sion Hospital where it is today. And we all feel so proud of him that he's in this position to make so many such changes in the hospital. May I request both of you to please be seated here only because it's a proud privilege. Now may I ask our team here, Rishi, if you can please go down and escort Dr. Nadkarni sir and Mrs. Suhasini Nadkarni. If you could please felicitate Dr. Satoskar sir here. We have to cause Dr. Nadkarni sir to speak now, no? Yeah. And then we'll be felicitated, correct? Meenakshi ma'am. Felicitate Prabhakar sir. And may I request Dr. Meenakshi to please felicitate Dr. Prabhakar sir. Come on. Prabhakar sir has worn matching dress to the seminar hall today. मालूम है ना? Surgical seminar hall and Dr. Prabhakar's dress is same color. So he has paid so much attention. Is it Sandhya or is it Prabhakar who is responsible for? Okay. Okay. Now for the event of the day, we've heard it from the students, we've heard it from people who have succeeded here, and the emotional statements Dr. Mohan Joshi made about every resident he has experienced while working. Not only residents who worked in his unit, but I think even Dr. Utture was in another unit, was also constantly aware of what is happening in the other unit. So everybody was aware what is happening in the surgery department, because jo RMO ka katta tha, RMO ke katta pe all reports used to come. Dr. Lad used to give all messages to Purohit and Santosh Palkar. Pankaj Patel, of course, used to spread messages like wildfire. So all these messages would go to entire department, and entire department would know. Is it right, Dr. Sudarshan sir? Dr. Deshmukh sir, Dr. Sudarshan sir, they all know about it. So we all enjoyed, and we actually have relived those moments thanks to Dr. Mohan Joshi's verbatim, messaging and giving us information about what happened. Now, sir, it's our privilege, Dr. Nadkarni sir, to listen to you. We know that we are all short of time, but you have time to speak to us from your heart what you think now is the way forward for blokes like us who have followed you, sometimes partly, sometimes wholly. And I must admit here, one of the WhatsApp group in which a lot of seniors have interacted, a lot of messages have been given. I hope everybody has read them. And we may not have the opportunity to actually, get everybody here on stage to be able to speak that. But I wish all of you go through those messages again so that you can relive those past moments. So, Dr. Nadkarni sir, teacher of teachers, they say there are teachers who teach you where to look. They don't tell you what to see. And Dr. Nadkarni sir is one of them who's always shown us the path, but never held our hand or spoon-fed us, told us to follow that path. So please welcome Dr. Nadkarni sir here on the podium. Sir.
Hello.
Okay. You want this?
Okay. Friends, Dean Mohan Joshi and friends, I'm really, I highly appreciate all the things that are said about me, but I'm really very, very happy to be here today because I met all previous students, colleagues, and that itself showed that the affection of all my past colleagues, I would say now, they were students, they were residents, but now we are all friends. And I'm really grateful that you all have come here for this function and allowed me to talk. I joined here on 2nd August 1973. That time the dean told me that the department will come 2-3 months afterwards. 2-3 months became 2 years. And in 1975, we shifted into the present building, and there were 16 rooms with one professor and one clerk. Nobody else. From that time onwards, slowly, we developed the department first. And then, as I saw a lot of work in the trauma, Mr. Rajni Patel gave some 2 lakhs to make an emergency van. I said, bringing the patient from somewhere in an emergency van, and then we had those same system of writing a call, searching for the houseman. So I said, if we take 1 hour to find the doctor, we will be put to shame. So if we want the van, we must have a ward with the doctor round the clock. And that's how everything was sanctioned very rapidly, because Rajni Patel was the biggest man in Bombay that time. And that's how our trauma ward came. And that ward, I really didn't know that it would make such a big name. But we were definitely well organized. One professor from Chicago, he had come on his topic, and he had visited Calcutta, Delhi, Ahmedabad, and came here. Then he went to Madras and then Singapore. But in the story, somebody that Sion Hospital was the only place where there is an organized trauma board and an extremely well developed, quick service in the whole of the country. So I was very Similarly, our deputy commissioner at that time, Karandikar, recently we met about 5-10 years back. We met and we had a talk. Very rich person. He was a joint commissioner, but in Bombay when he was a commissioner, he said, I met a very big person, industrialist. He had his powers, the telephone numbers, the CMO's one, where to go at the hospital. And he said, I have to mind that if there is anything going wrong, any accident anywhere, very proud. Ramsal Hospital was the first choice of big industrialists if ever got into trauma. Well, those things happened. I only said that I have worked as sincerely as possible. I became the professor. They asked, what are your plans and all? And I said, I will do my best. I will do my best. When I came again, they said, we'll do this way, we'll do that way. I said, I will do my best. I did not promise anything except that I will do my best. And I think I sincerely tried my best to do my best, whatever I have done. I very sincerely thank the organizers, the dean. My daughter has taken such a big trouble to organize and show all this. My only obsession today is cost. I am very cost conscious, and I would deeply worried all the time about the rising cost of health services. So I tried to write a book. I have written, I hope I will get a publisher to publish it, but I have written a book named Cost Control in Health Services. I hope that I'm able to tell, if that book comes up and people read, because I wrote some other books which I only read. So I'm not sure whether this book will, but the topic is of interest today. And I have tried to show how we need not go after technology. Are we giving today health service, or are we giving modern technology? In USA, they freely use the word sell and purchase. So what are they purchasing? Are they purchasing health service, patients, or are they purchasing technology? And I have tried to emphasize that costly drugs, costly technologies, unnecessary MRIs, very costly investigations, are they really necessary? Maybe they are necessary in very complicated cases, at 10%. But remaining 90% need not suffer financially and go down in health. That's what I feel today is happening. And I've written the book to show how we can modify medical education itself, and also how we can control the unnecessary investigations, unnecessary costly drugs, so that health service will become more affordable to a common man. Because that's the thing. The other thing that is necessary is expansion of the public sector. If these two things happen, then only health services will reach the common man, the poor man. Otherwise, they will remain the privilege of the rich, affording people. And even they suffer, not they, because we are not statistically conscious. We don't try to analyze and say, so many patients we have treated, this is the result, this is the 5-year result, this is the 10-year result. Nothing like that. I have treated, he is all right. If he is not all right, something else is the cause. So we brush aside and proceed. I think we should stop that and try to analyze, at least in the medical college, with cost effectiveness. Are we giving cost effective treatment? So I suggested one thing in that book also, that is, we should bill the patient. In the public hospital, billing is not at all difficult. So just the services given to him, not the college, not the watchman, not the actual service, or theater, lab, and such things, and the doctors. If a cost estimate is given to, I suggested this in 1976 in one article, and that article was highly appreciated by somebody like Ramalinga Swami, who was a UGC president. But nothing has happened. At that time, I was not in a position. Even today, I am not in a position. But I feel we should start to give a cost estimate or a bill to every patient who is discharged or dies, so that we ourselves will know how much we have spent for the disease, for that patient, and was it necessary. Once that cost consciousness comes, I think the idea of reducing the cost will automatically strike the mind. And that itself may make health services more productive, more useful. Today's not able to really analyze and give a percentage, but I have no doubt that nearly 2/3 of the expense at present is for other things in the health service. And if we can reduce it, and if we can make health affordable, then that will be the greatest achievement for this college. I appeal to this college, the dean, to get into this idea and try to work out so that we become cost effective for the patients. Thank you.
Ladies and gentlemen, such moments come rarely in the lives of surgeons that colleagues, students with whom they have worked, they are all be able to meet many, many years later. We have eminent, busy members in the audience who have taken the trouble to come here today. I, on behalf of all the residents, all the past students, past teachers, would request Dr. K.K. Mehta to please come up and just present a shawl and a coconut on behalf of all in the audience here. So if you can please come up and just... Dr. K.K. Mehta had worked in the surgery department for many years. He used to take lectures for us when we were undergraduate students. And I would like him to represent all of us to please come up and offer this on behalf of the students. I will always also request Dr. Prabhakar on behalf of the department. Request Dr. Meenakshi. She's there. If you could please offer this to Dr. Nadkarni, sir. Sir. Sir, पुढे या. नहीं, मैडम लोग पण. Sir, थोड़ा पुढे या. So this is on behalf of everyone in the audience. Dr. K.K. Mehta has been very kind to get this shawl. Yeah. And we request Suhasini ma'am also please come up. You can offer it to madam. You can offer it to madam. And may I request Dr. Meenakshi on behalf of the Department of Surgery to offer our respects to Suhasini ma'am. Please give her a big round of applause. She has been the lady who's been really behind and always supported Dr. Nadkarni sir and all the surgical residents, made them happy with a smile on her face. Very cheerful lady, and as Sangeeta put it, the word Suhasini really means it speaks for itself.
Page lagu to Dr. Nadkarni because he was my teacher, taught me all the techniques of surgery and administration. And Page lagu to Mrs. Nadkarni because she put in his ears that please help Mohan Joshi to become lecturer. Thank you so much.
So Dr. K.K. Mehta wants to lead by example that all of us who have come here together owe something to the surgical department. He owes something to the surgery department and he's handing over a token of his gratitude to the surgery department. That is his gesture, and I suppose in various forms and shape you can all contribute to the surgery department and make sure the name of the surgical department remains very high in Bombay University. Yeah. Dr. Gatam. नहीं, एक मिनट डॉक्टर गौतम सेन को पहले बुला के करना. There's a gentleman who has come and taken the trouble all the way to. Please take your seat, sir. Ma'am, please take your seat. We are not going to take too long, so I just expect patience only for a few more minutes before we wind up for lunch. So I know there are a lot of people who would want to talk, a lot of people who want to speak, but obviously we can't be really going on and on. All of us would have that time. I think during lunchtime we can talk to sir, talk to each other and spend those moments. There are people who have worked with sir here in the department, but there are men who have been associated with sir outside this department. And I think the contribution which Dr. Nadkarni sir gave to head injuries, to management of the emergency ward, trauma care, is what distinguished Sion Hospital surgeons from other surgeons. Dr. Gautam Sen is a gentleman who has had a very good association with Dr. Nadkarni sir, and he would love to pay his tributes to Dr. Nadkarni sir, and he has prepared a citation for Dr. Nadkarni sir, and he would like to offer the citation to Dr. Nadkarni sir in our presence. Please give him a big round of applause so that we can welcome Dr. Just read the introduction and read the finale.
And as a colleague of Dr. Nadkarni, from what I heard, I have worked under him, people like him in Tata Memorial as well. And I was trying to tell Mrs. Nadkarni that how did you get along with this man? And he was a difficult man and man of principle. And I want to read this. Professor S.V.NADKARNI, Association for Trauma Care of India, is proud for this rare honor bestowed on you by dedicating this grand surgical lecture hall named after you. You have pioneered in setting up India's, as far as we know, in setting up first trauma center, and setting up a blaze of your students becoming trauma surgeons. Professor Satish Dharap, who was the first member of ATCI to take ATAS course of the American College of Surgeons, is one of the examples. The Sancheti Hospital in Pune and Rajiv Gandhi Institute on Trauma in Bengaluru of what work you have done. You have been a founder member of ATCI and has seen the growth of ATCI, including bringing ATLS course of American College of Surgeons in India. Your revolutionary and bold reform ideas, you say that nobody reads it, but we tried to bring in as we took the first board of governors appointed by presidential decree in 2010. All your ideas of reforms in medical education and service and cost cutting in healthcare service were taken very seriously by board of members of the Medical Council of India then. Your life, as Paget has said, 150 years ago, addressing the young surgeons and the young doctors, and I quote, "Our reward is paid to us part in money and part in kind. We cannot keep separate, as it were in two ledgers, these two incomes. Nor can we say exactly at any time how much we are worth. Our lives are invested in the goodwill of friends, in the confidence of patients, in the approval of our brethren, in our hospital records, and in our intention of sticking to work. All these and like securities are but other name for ourselves. This Paget had said 150 years ago, and you are the example of that. It's a great honor for me to hand over this citation to you. Thank you. Say many things, but I couldn't.
Yeah, thank you.
You want to hand this book to sir as well?
Yeah. This a small write-up about your work in a station for Academy. And we want you to rejuvenate ATCI again. Yeah.
Just hold that like that. हे फक्त होल्ड करा. हे मॅडम तुम्ही होल्ड. कन्फ्युजन व्हायला लागलं माझं. नाही काय हरकत नाही. फक्त असं just hold. Now, it is an ardent desire of the Dean, Dr. Mohan Joshi, that all those surgical blokes who worked under him, with him, above him, please join us up on stage with Dr. Nadkarni sir for a pleasant photograph. To Dr. Utture, Dr. Anil Patwardhan sir, Dr. Ravi Gupta, Dr. Purohit, I don't need to name everybody. Everyone who thinks he's done something with the surgery department, please come up. Dr. Deshmukh sir, Dr. Nadkarni sir, Dr. S.V.NADKARNI sir, तुम्ही वरती आहे sir. Dr. Anantram sir, Dr. Sule sir,
एक मिनिट हे राव थांबा 2 मिनिट नाही हे वेग संगीता येते येऊ दे हां येऊ दे ना सरांना येऊ दे सर नाही आले सर जयश्री मॅडम सर थोडंसं सर कॅमेरा सर थोडंसं कॅमेरा
सर थोडं क्रॉस
सगळे ॲडवाइस ऐकूया.
तिकडे
सर थोडं क्रॉस
एक उभं राहून शॉर्ट घेऊ सर कॅमेरा सर एक मिनिट थोडंसं मागे थँक्यू झालं का व्हिडिओ रेडी आहे
रेडी
हां सर जरा समोर एकदा
Please come inside. Please come पूरे आतमध्ये त्रिवेदी मॅडम आतमध्ये या 2 मिनिटं बसा मॅडम बसा डॉक्टर अनिला प्लीज सिट 2 minutes only there were 2 teachers. Actually, I will speak now, but this hall was very much close to Dr. Nadkarni's heart. He was the only person who used to be insistent on 3 o'clock postgraduate clinics, and we used to sit here and learn whatever philosophy, concepts, wiring, discussions, dissections of the cases, everything we learned here as postgraduates. Sometimes after coming from OT, we used to be, feeling sleepy. Sometimes we used to be hypoglycemic, but still, you had to come here at 3 o'clock and nobody would go away before 3 o'clock. That was the discipline of Dr. Nadkarni, sir. This hall was very close to him as far as the postgraduate training was concerned. And his 2 philosophies I remember. He never entertained anything for postgraduates in the morning hours. That was his philosophy. Because he said,
येऊ दे ना सरांना येऊ दे आधी सर नाही आले सर
सगळे ॲडवाईस ऐकूया
तिकडे
थोडं क्रॉस
एक मिनिट उभं राहून शॉर्ट घेऊ सर कॅमेरा सर कॅमेरा एक मिनिट थोडंसं मागे या थँक्यू झालं का व्हिडिओ रेडी आहे
रेडी
हां सर जरा समोर एकदा
पुढे आतमध्ये त्रिवेदी मॅडम आतमध्ये या 2 मिनिटं बसा बसा डॉक्टर अनिला प्लीज सिट 2 minutes only this there were two teachers. Actually, I will speak up, but this hall was very much close to Dr. Nadkarni's heart.